Hello, my name is Patty Burkus, and I want to share some highlights of my poster with you. My poster is called Patient Safety Impact, Implementation of Electronic Consents. Elements of patient care require permission or consent by the patient or guardian. The permission is documented and needs to be available in the patient record. If the process is not timely, it can delay care and increase risk to patient safety. Children's Hospital Philadelphia committed to reducing risk and reducing the risk to patient safety, and we wanted to improve the consent authorization workflow. Our current paper workflow includes many steps, and it has possible user variation, which we found many different people doing many different things. Illegibility and missing information were the most common errors found pre-implementation. Employing principles of quality improvement framework, our institution initiated an enterprise-wide implementation of an electronic consent workflow. Ease of use, expertise with the EHR, and targeted staff training supported user adoption. We did start in departments who had the highest number of consents, the surgical divisions, and then moved to medical divisions, and then to the inpatient areas, as well as the clinical support departments. We did complete some pre and post implementation review of sample size of consents in different departments. In addition to the departmental review of consents, we also decided to look at organizational incident reports for a period of 21 months. And in the 21 months, there were a total of 248 reports. Of the 248, we found 159 reports that had issues related to consents. Of that 159 reports, we did find 263 safety risks. Some of those reports, the 159, did have multiple issues associated with the consent. The reports that we did look at, we did separate into 4 consent types. Our leading group were procedural consents. We then looked at blood transfusion consents. We also had admission, discharge, and transfer consents, as well as a group of miscellaneous consents. As far as these 263 safety incidents, I want to highlight just the 2 largest groups. We had a group of missing information or incomplete forms, and those were things like missing a signature, a date, a time, or the risk factors of a procedure. And the other one was actually consent filing and storage incidents. And that, of course, we found some consents were found in the wrong charts. Some patients had their providers try to scan or photograph and scan a consent. And when they did that, there were darkness and readability issues with those consents. So they were the largest categories we found of issues. In summary, our new process has fewer steps, it has little variation, and the consent is created and never leaves our EHR. The consenting party has 2 available electronic methods to review and sign their consent. They can use a patient family dedicated hospital iPad, or they can log into their patient portal, and we can send the consent to the portal for them to review and sign on their personal device. Post-implementation results have found that the necessary information is present 100% of the time in our EHR, and of course the consents are legible. We are tracking adoption of our processes through departments using a dashboard, and this will inform leadership of any areas or issues that we need to investigate further and improve upon. Thank you for reviewing this work with me, and have a good day.